This podcast and content posted by Dr. Judith Joseph is presented solely for general informational, educational, and entertainment purposes. The use of information on this podcast or materials linked from this podcast or website is at the user's own risk. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional diagnoses or treatment. Users should not disregard or delay in obtaining medical advice for any medical or mental health condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Corey Minor Smith moved 21 times and attended 14 different schools before graduating high school. And throughout her childhood, she was a teenage caretaker for her mother who was living with a severe mental health condition.
My lived experience includes my mother being diagnosed when I was about 14 years old with what is now known as bipolar disorder and schizoaffective disorder. So through that experience of taking her to the emergency room back when I was 14, not able to drive and having to rely on family, it's been a learning process.
In spite of these obstacles, she became a successful attorney. These adverse childhood experiences, along with becoming a trained facilitator for NAMI, the National Alliance on Mental Illness, have paved the way for her becoming a mental health advocate. Currently, she is appointed to serve as US Senior Counsel for HUD, the Department of Housing and Urban Development. On this episode of The Vault, we talked about the challenges that caregivers face when living with someone with severe mental health issues and ways to support families and caregivers with resources and training. Corey has also written books and guides to support families who have had similar challenges due to having loved ones with severe mental health conditions. Corey, welcome to the Safe Space.
Good evening. Thank you for having me in the safe space. I'm honored to join you tonight.
You and I met recently at an event held by Charlemagne the God, and we were talking about mental health and advocacy. And I was just so fascinated by what you do with your background. So tell us a bit about what you do and how, your training and your experiences led you to be a mental health advocate.
Sure. Well, I'm an attorney, an author, and an advocate. And my lived experience includes my mother being diagnosed when I was about 14 years old with what is now known as bipolar disorder and schizoaffective disorder. So through that experience of taking her to the emergency room back when I was 14, not able to drive and having to rely on family, it's been a learning process since then to just know what this diagnosis is, what it was at the time, and also that it would be a lifetime commitment to helping my mother to live the highest quality of life possible. I'm able to use those words now. Definitely did not know that or expect it at the time I was 14, but it has given me the passion to help other people who are in the same and similar situation to be able to help their loved ones living with severe mental illness.
And you were telling me about some of the work that you're doing with government now. So tell us about that. It's very exciting.
Well, thank you very much. Yes, in my trade as a lawyer, I have worked with the government and public service throughout my now 22-year career. And currently, I am appointed to serve with the Biden-Harris administration. And I serve as senior counsel for the Department of Housing and Urban Development. And that is separate and apart from my work as a severe mental illness advocate. But at the same time, I am able to exhibit my passion and be involved in the work that I love and enjoy when it is helping individuals to have their housing rights, have quality housing, and that's across the board, but especially having a extra compassion for those who are living with disabilities such as severe mental illness.
When we talk about therapy and mental health, someone could be in therapy, they can be on medications, but if they have no place to live, if they don't have insurance, if they don't have resources, then what can therapy do for you?
Right.
So it's so important to think about this in a holistic way. And you do a lot of work with regards to caregivers and burnout and how to support people with mental health issues. So if someone is listening and they have a loved one who has serious mental health issues and they're just not getting help and they're, they're in denial or they're not really accepting of their condition, what are ways that you can support them?
Yes, thank you for that question, especially in November. This is National Caregivers Month, and a lot of people serve as family caregivers, long distance caregivers, or caregivers in the home with their loved one. And in terms of the caregiver, I do strongly suggest that they have a standard practice of self-care. And I'm not just talking about the luxury go to a spa type of thing, but something that you regularly implement to help you to be able to debrief, because it is an exhausting service out of love for your loved one. But in terms of caregiving and just having a career is a tremendous responsibility. And for those who choose not to accept medication or treatment, it can be very, very complicated. And that's when you get into the different laws, especially in terms of a person having their personal rights, their civil rights. And we want to make sure that those are in place, intact, and that they are not violated. But at the same time, that person being healthy and safe, as well as their loved ones being healthy and safe. So it is a fine line, but there are systems in place to help family members, such as having a guardian. In some jurisdictions, it may be called a different name, but through the probate court or a family court, there is something similar to a guardianship that may be available to help you to be able to navigate these spaces. So I encourage people who may have a loved one who does not want to take medication to continue to embrace that person, to talk to that person. And unfortunately, many are dealing with anosognosia. And it is a lack of insight, like they don't even know that they're sick, and it's not denial. So it makes it very complicated. Mm-hmm. And ultimately, I encourage people to work with the resources that are available in the community, such as the ACT team, the Assertive Community Treatment Team, if it's available. There's also the Assisted Outpatient team or treatment that's available, and to see what organizations in your community provide those services.
Yeah, anosognosia is something that people who have schizophrenia, I think like over 90% of people have anosognosia, where they don't really believe that they have a mental health condition. People with dementia, I think like 85% of people have it. And then large numbers, above 50% of people who have bipolar disorder have it. Mm-hmm. So it's actually a symptom of the condition.
Correct.
Right? So imagine if you have asthma and you can't breathe, but then you're like, I can breathe. I don't have asthma, right? And you're not getting the treatment. It could be very, very frustrating and painful for someone who is a family member to watch their loved one not getting treatment, right? It almost feels like they're not allowing themselves to live a full life, to do the things they want to in life, but you really can't do anything. You feel like you can't do anything about it when, they're not a threat to themselves or others, right?
Correct. So and then it's the standard based on that person, because they can be their behaviors, even though they may, have suicidal ideations and verbalize those, it may not be enough based on their diagnoses and their baseline behaviors. So it's just very, very complicated. And I just encourage people to please tap into the services that are available in your community.
And definitely find support in peer groups, because there are groups like NAMI provides a lot of family and caregiver groups where you may be able to learn from another family who has been through things similar to you.
Yes.
And they can tell you, do this and do that, or don't do this and don't do that. And then you could help them out too. So it's a sense of community, so you don't feel like you're alone in this, because a lot of times you do feel very lonely.
Yes, I absolutely agree. And it's nothing to be ashamed of. It's important that we acknowledge that stigma is real, but we have nothing to be ashamed of. And it is important for our own quality of life as a caregiver and those who are living with the illnesses to know that there are services and they are entitled to those services and they should use them.
As an advocate for caregivers, what are some of the things that you're constantly amazed that people don't know as a resources? What are some of the tips that really you can provide to people who are listening who may be caregivers?
Yes, absolutely. Well, one is NAMI, the National Alliance on Mental Illness. That is my number one go-to. I remember my aunt putting a newspaper clipping in my mailbox to tell me about these different peer support groups and family-to-family groups that NAMI that provided. And ultimately, I went through that course. And at the time, it was a 12-week course. Now it is an 8-week course. And I am currently a trained facilitator for NAMI. And I find it so interesting that people are just finding out about it when they join this group, and ultimately that they are very pleased and happy that they did, because it gives them some better understanding of what their loved one is dealing with, as well as best practices in how to communicate and just move forward in this life with your loved one who is living with severe mental illness.
And sometimes, because you have family members who have severe mental health issues, you may have this anxiety about yourself. I've seen this time and time again in my practice, where I have like a patient who is worried about their child developing a mental health condition, or they're worried because their parent had a mental health condition and they're worried about passing that on to their child, and ways to prevent that. What are some of the things that you see in your work as an advocate?
Yeah, I think it's important for people. I understand that concern, and maybe even to the level of having a fear, but it's not that clear cut. It's not an automatic genetic trace to a mental illness. There are a lot of environmental factors that could be involved. There's just a tremendous number of factors, and there is not any one thing that could cause someone to have mental illness. And there's different things that could happen, like a car accident, and you have a severe brain injury where you will have the same and similar types of symptoms as someone living with severe mental illness. So what is important is to recognize the symptoms and know that there are resources to help the family as a unit. And unfortunately, a lot of family members just cannot continue to deal with the issues that come up as a part of this life. But tapping into those resources and not being afraid to do so are just critically important in this work. And most importantly, again, the self-care. I often think about B.B. Moore Campbell, which July is named in her honor, National B.B. Moore Campbell National Minority Mental Health Awareness Month in July. But she often said, it's important to get a checkup from the neck up. And that's for everybody, right? Just like we focus on our physical health, hopefully we are also focusing and prioritizing our mental health. So we don't have to wait until something is wrong. You can do a mental health assessment or inventory. And one organization I haven't mentioned yet is Mental Health America. And you could go right online. Now, it doesn't substitute for mental health professional going to see a mental health professional, but at least it can give you some idea of what you may be dealing with. And then you can talk intelligently or develop the questions that you want to ask a mental health professional so that you can know what treatment and services may be available to help you through.
And sometimes you're waiting for a therapist, right? You may be waiting to find an appointment or on a wait list for your loved one. One of the other things I suggest is mental health first aid and emotional CPR, right? So you can learn about the red flags, the warning signs, ways to support someone, ways to talk to someone about difficult topics so you don't feel like you're alone and you don't have any skills. These are things that anyone can take advantage of. Some of the courses are online. You can get certification. Sometimes local churches have workshops, so you can learn ways to support your loved ones and learn more about it. You just have to access that information. And lastly, you have one of those unique skill sets because you know the law and you know health. And we know very few people know that. And sometimes people find themselves like trying to find services, but they hit like this block, right? Or they find that their insurance isn't covering, or they're getting the runaround. What are some of the things that people can utilize when they feel like they're trying to get care, they're trying to get services, but they're just hitting a roadblock?
You know what? It's one thing as a lawyer that we know people don't always read all the fine print in their documents, but I suggest that you look at your insurance plan and find out about the Mental Health Parity Act, which insurance companies are responsible for treating mental health as well, the same as physical health, and covering the services that are needed for a person. So find out what your plan states and ask questions of your HR professional, and take advantage also of the employee assistance program. That is a free program and service. Some people are, concerned about using that. They think their employer is going to know everything that they're talking about, but it is a confidential program, and I encourage people to find out more about it. But especially in terms of insurance, to find out about the plan coverage and to challenge those things and find out out how you can appeal, if necessary, the coverage for certain services or time in a facility. And additionally, I encourage people to just know about the free resources. You named a few. The Mental Health America has free resources, and the National Alliance on Mental Illness has free resources. So peer-to-peer support. And with COVID, the pandemic that we all have been dealing with and still deal with, there are virtual courses that you can listen to. So, just because we went through a pandemic didn't mean that, mental health issues went away, right? They had to navigate, pivot, and find out how to still get these services to people. So again, you could do those things online. The person who is, dealing with a mental health condition can find that support online, and hopefully, also make in-person appointments as we are continuing to now go in person to meet with people.
Yeah, even if you look at your city's health department website or your state's health department website, and you go on under the mental health resources, there are virtual and in-person resources there, because you're absolutely right. We're not aware of all of our rights. We are not aware of all where our tax dollars go, right? So imagine how many millions of dollars go a year where we're not tapping into these resources that were meant for us, and we don't know about it. We don't know our rights. I always ask my guests about a time when they were struggling, right? And on the outside, people are like, man, they got it figured out. They have everything going the right way. They're so put together, but you knew that you were struggling inside. And how did you get through that time?
I really appreciate that question. And I'm going to say that was actually just this week, just to show the reality of it, because people do think they see the outside and they don't think you're going through any issues. But my way of working through it was to do a reel, because I knew that there had to be other people who were doing or dealing with the same type of issue as a caregiver, and you are building your career. So that means you work during the day outside of the home in many cases. So when you get a call that is disturbing, like your loved one has been arrested, or your loved one is frantically screaming and hollering in the middle of the street, or your loved one is refusing their medication for the third time, and you have to stop yourself from going down a rabbit hole of knowing all that could happen when your loved one stops taking his or her medication. How do you deal with that when you're at work and you need to pay attention to the task at hand at work? So I was feeling that this week, because I had one of those conversations, like all the years that I've been doing this work. It doesn't take away that sense of powerlessness and that sense of uncertainty and not having all of the answers. But what it did provide me was a space to help other people, because no, you may not know right away, but what you can do right now is take a break. What you can do is go for a brief walk down the hall and back. What you can do is take a drink of water and just breathe for a moment, and then take the time to compartmentalize and how you're going to move forward to get through your workday, as well as address whatever the issue is with your loved one at that time. So I just share with people to not think that it's impossible. And I'm not saying that there aren't any issues, but there are ways to navigate through them by first acknowledging what you're feeling and going through, and it's real and it's okay. And two, accepting that this may be a part of your life going forward as a caregiver if you're going to take on that role. And then thirdly, joining in the advocacy, helping your loved one and making sure that you are speaking on that person's behalf, because many times they are not able to speak for themselves with the people who are supposed to provide treatment and services for them.
I love what you say about you shared, and that was powerful for you. And over the years, treating several families and caregivers and patients, I find it so fascinating that when people start to share, they feel so much better. And I've had situations where caregivers will not tell anyone what's going on because they don't want people to look at them a certain way. They don't want their boss to think they're going to be problematic. And then the moment they share, they not only get support, they get understanding. They feel better. Secrets really weigh on you, and not having support and community really weighs on you. So I think that sharing is so powerful, but not a lot of people do it.
Yes. I agree. And I just want to share this one thing that can be easy to remember. 988. That is a tremendous resource that a lot of people spent a lot of time advocating for and running all the traps to make this available nationwide. T-Mobile was one of the first cell phone companies to have it available for their clients. But I encourage people to learn about 988, know when it is beneficial to call if your loved one is having a mental health crisis or a substance use crisis, and call that number instead of 911. And hopefully, those who are in this space, the mental health professionals and others who are working with individuals that have severe mental illness, understand and know the importance of calling 988 instead of 911.
Well, thank you so much. Tell us where we can learn more about what you're doing, your projects, your book. Tell us where we can find you.
Sure. You can find me on all the socials under Corey Empowers. And I encourage people also to download my go-to mental health guide, which I provide a lot of different information, podcasts, movies, books, just to help you learn and understand. And then also organizations that provide services, whether it's in person or online, virtual programming and activities, all for those who are caregivers as well as those who may be living with a mental health condition. So Corey Empowers on Instagram and Corey Minor Smith on LinkedIn. And I just truly appreciate this opportunity to share with you today.
Well, thank you so much for being in the safe space and sharing your expertise. It was really empowering.
Thank you very much. Have a great day.